evening to everyone. This World Parkinson's Day, we're very happy to welcome Dr. Paresh Doshi, who has been a pioneer functional neurosurgeon in our country. He has started performing DBS surgery since 1998 and until date has an experience of more than 450 successful surgeries. He has been credited with several firsts, including the first DBS in India, DBS surgery on the oldest patient, DBS surgery on the youngest patient, DBS surgery in previously implanted cardiac pacemaker patient, etc. to his credit. A very warm welcome, Doctor.
Thank you. Hello, listeners.
What causes Parkinson's disease?
That is $1 million question, and if we knew everything about that, we would not be today talking about Parkinson's disease on the World Parkinson's Day. Before I answer your question, let me just remember once again Dr. James Parkinson. Dr. James Parkinson first described Parkinson's disease symptoms in 6 patients more than 200 years back, and even today, this description holds true, and we make the diagnosis of Parkinson's disease based on the description offered by James Parkinson. We have perfected it, but still that remains the goal post. Now, most important question, what causes Parkinson's disease? Basically, Parkinson's disease is a movement disorder that arises when around 80% of the cells in substantia nigra are lost. When there is a cell loss of more than 80% in the substantia nigra, the black substance in the brain, the dopaminergic cells, that is when the lack of dopamine causing Parkinson's disease symptoms.
Thank you, Doctor. We have a viewer who's asking us, is there a cure for Parkinson's disease?
Unfortunately, we do not have the cure for Parkinson's disease. A lot of research and science is exploring the possibility of a cure. We have many research projects in the pipeline, but as of now, I don't see any of those results coming in next few years. But we don't need cure for most of the diseases. We don't ask for cure for hypertension. We don't ask for cardiac disease cure. We don't ask for diabetes cure. We all know that these are the diseases which you may get, and with adequate medical treatment that may be managed. So my message is, if an adequate medical treatment is offered, this disease can be adequately or correctly controlled to offer almost like a virtual cure. You might have to continue taking some treatment for that.
Speaking of adequate treatment options, what are the treatment options available today for Parkinson's disease, Doctor?
Okay, Parkinson's disease, now the concept of Parkinson's disease is also changing very widely. And I would like to use this platform first to highlight that. Previously, we used to think that Parkinson's disease is a disease which is located in one part of the brain. It's a small area of the brain that is responsible for the symptoms of Parkinson's disease. But over a period of years, now we have realized that this Parkinson's disease is a multi-system disease. In every patient, this disease manifests as a different with a different perspective. So one patient may have this different symptom complex, which could be different from this patient B who has a different symptom complex. And hence, each patient would have to be treated differently and individually. So we do not have a fixed method of treating, but we have a complex medical treatment and later on surgical options available for treating Parkinson's disease. To answer the question, the initial treatment of the Parkinson's disease starts with medical treatment. Once the medical treatment is instituted, the second important thing is to understand which are the important symptoms that causes handicap, treat them medically. Rest of the smaller or minor symptoms give patient confidence to live with, modify partly his lifestyle. I'm not asking a major modification in the lifestyle. So if you enjoy playing golf, you play golf. I would not recommend you to leave playing golf. You may think that, oh, playing golf is a luxury and it's only available to a patient. But yes, I had a patient who was an ace photographer of the country. He showed me photographs with Jawaharlal Nehru to Gandhiji. And at the age of 65, when he came to my clinic with Parkinson's disease, he said, "Sir, I cannot go to play golf in the evening with my friends. I have worked for 60 years of my life. Can you help me?" And I did help him, and he continued to play golf. So it is important that some modification you can do, but not all, and you can continue to engage yourself in the activities that enjoy you with medical treatment, minor lifestyle modification. Yoga is an important aspect. Getting right counseling is very important. Sometimes you may have some other problems. Once they fix, like psychological problems, once they get fixed, you have better control of Parkinson's disease. So a comprehensive medical management of Parkinson's disease, and when the medical management is not adequate, when you find that it is not giving you the same level of satisfaction that you used to get 3 years back, 4 years back, 6 years back, that is when probably you can start exploring the surgical option.
Speaking of medical treatment, are there any non-drug options that might help?
Non-drug options will help to support the treatment of Parkinson's disease. They cannot substitute medical treatment. We all need to understand. Parkinson occurs. Why Parkinson occurs? Parkinson occurs because of lack of dopamine. Your car runs because of petrol. You tell me, do you have a car, not the electric car, I'm talking about a regular car that anyone can build, and ask me, sir, can you give me a car? I am ready to pay 1 million rupees, but it should not run on petrol. It should not run on diesel. It should not run on any fuel. It should run on its own. I have spent $1 billion on this, but it should run. No, it cannot. So same thing, you cannot ask a diabetic patient not to have substitution of insulin. Same thing is for Parkinson's. You have to have substitution of dopamine. The amount of substitution can be adjusted depending on lifestyle modification and additional therapies that you employ, like meditation, yoga, and regular exercise.
Thank you, doctor. Speaking of movement disorders, what causes movement disorders?
Movement disorder is a very broad term. Parkinson's disease is one of the movement disorders. Any disorders which affects the movements of the body. 90% of the time, this is secondary to the degeneration of some part of the brain. The other movement disorders are dystonia and tremors. Tremors means shaking of hands. Dystonia is abnormal posturing of body parts. Fortunately, dystonia is not very common. Only few people get affected, so we will not talk about it. Tremor is very common, and not all tremors require treatment. So many of the tremors may not require any treatment. So that is another movement disorder. And for each of this movement disorder, the cause is different. 80% of the time, as I said, it's neurodegenerative, but rest of the time it could be metabolic, it could be secondary to trauma, it could be secondary to genetic changes, and many factors.
Are there any foods, supplements, or over-the-counter drugs that I should avoid, doctor?
Many physicians advise to limit the red meat intake and high protein intake along with Parkinson's disease medications, because they are known to interfere with the absorption of levodopa. So you should try to restrict the amount of this or not combine the meals along with the drug. Apart from that, I don't advise my patients any important change and modification of life or food.
Thank you, doctor. We have a question. I am 42 years old. What should I keep in mind to tackle movement disorders?
Nothing. Just don't think about it. If it comes, you seek counseling. But if it doesn't come, do not bother. There are millions of diseases that we know about. We don't have anything to do with it, and it will never touch us or our near or dear ones.
And he goes on to ask, in general, are there any symptoms that I should be looking out for?
No. I never ask my patients to watch out for any side effects of medicine treatment or look out for symptoms that they will develop this. Because we know that I cannot prevent any of these diseases. So why should I ask my patient to get anxious and start looking out of? Otherwise, I will have hundreds of people being bothered with mild tremor. I also get mild tremor when I'm stressed. So what is that? It's not a movement disorder. So don't think about it. I would like to tell this viewer that just forget it. Like hundreds of other diseases which will not affect him or her, this will also not touch her.
Is there an alternative of brain stimulation in movement disorders, doctor?
The first line of treatment is medical treatment, and the second alternative to deep brain stimulation is a therapy called lesional surgery, wherein instead of implanting electrode, deep brain stimulation basically involves implantation of the electrode and stimulating that electrode with the help of a pacemaker which is implanted under the clavicle bone. All these things are internally wired, you cannot see it externally. Now, instead of deep brain stimulation, sometimes what you can do is create a lesion. And I use this lesion technique by destroying some small area of brain, that is small group of neurons in the brain, to restore the balance of movement disorder. And most of the time this is done on one side of the body. So if the patient has a unilateral movement disorder, say one side of the body is affected with tremor or dystonia or something else, then we can offer a lesioning solution.
We have a question. My mother-in-law suffers from dementia. Family members manage her with forgetfulness, repetitive questions, anger, sometimes irritability. But most particular times of the day, like in the afternoon and night before going to bed, she becomes unmanageable. She keeps asking for people in her past and insists to call or meet them. Kindly advise if any medication can be given or should I come and consult?
Uh, Unfortunately, this person is describing the near one of his as a patient suffering from dementia. Dementia is a mental disorder wherein you start losing memory and behavior changes. One of the common form of dementia that all of us know is Alzheimer's. I'm not sure what kind of dementia this patient is suffering, but this dementia, at the moment, we do not have surgical treatment for this. I'm a neurosurgeon basically, so I would recommend that this person goes and seeks a good medical advice. We have some good medical treatment options available. So if you start taking medical treatment for this, you may benefit.
Thank you, doctor. We have a question. How will I know if my Parkinson's is getting more advanced?
Yeah, there are two different ways of knowing this. One is what I tell the patient is when the medical treatment falls short of your expectation. Let me explain you what I mean by this. Let us say you have a Parkinson disease, and initially you used to take one tablet in the morning, levodopa tablet, which used to last for 6 hours. After 4 or 5 years, you start realizing that the improvement doesn't last beyond 3 years, 3 hours or 4 hours. So you go back to the doctor adds one more tablet. So now you take 4 tablets per day and every 4 hourly. So it lasts through the day. Again, 2 years passes. Instead of 4 hours, now the medical effect wears off in 2 or 3 hours. That is where you start adding more tablets. Once you start adding more and more tablets to get the same amount of benefit that you used to get 2 years back or 3 years back, then the side effects of this medicine starts coming. This is when you start thinking of that your disease is advancing. USA FDA has considered this to be enough indicator or enough selection criteria for offering a surgical option to this patient. I'm not telling you that every patient who gets this should get operated, but if he wants to enhance the quality of life, and it has been seen through various double-blind studies involving several centers across Europe and large number of population, that this kind of patient who starts having short duration of improvement with medical treatment along with early side effects, if they are offered surgery in advance, then they may have much better quality of life and much better improvement in their Parkinson's symptoms at the end of 2 years follow-up, not immediately. After 2 years follow-up, they found then the same patient being offered only medical treatment. So they had actually randomized 2 sets of patients. One group of patients received surgical treatment, one received medical treatment. And you can also Google it. It was called early STIM study, EARLY, early STIM study. And this was done across several centers across Europe. And based on this study, US FDA has now approved deep brain stimulation to be offered for Parkinson's disease patient with early motor fluctuation.
Thank you, doctor. We have a question. My mother has multiple infarcts in the brain, and doctor has diagnosed vascular dementia for which there is no cure, they say. Is there any hope? Kindly advise.
Once again, this falls to the similar question that we had earlier. This patient is suffering from dementia, and vascular dementia is unfortunately one of the worst dementia that should come to patient, and there is very little treatment. Definitely no surgical treatment is available, but there is very little medical treatment also available for that. But I would suggest that this person continues to consult the neurologist to see what best benefit he can get.
Can you advise us on the new treatments that have been recently approved? in the world of Parkinson's?
I told you, the new treatment, the deep brain stimulation, apart from the medical treatment, there have been 1 or 2 new drugs which are coming, rotigotin patch, and there are 1 or 2 new drugs which are in the pipeline, which are likely to be launched in India very soon. They have limited efficacy, but they have definitely improved the armamentarium of the medical treatment that we have for Parkinson's disease. Going to the next level of treatment, that is the surgical treatment, there have been several advances in the type of surgical implants that we use. Initially, we used to have implants lasting only 4-5 years. Now we have implants or the pacemaker that can last up to 25 years. Initially, we had implants which could be stimulated only at 4 contact points. Now we have implants which can be stimulated at 16 contact points. So we have got large amount of flexibility and safety and improvement in technology, which has helped us to improve the outcome in patients undergoing surgery. Many other technological advances are also coming, but they are still not available to any person in the world apart from research, and hence I would not talk on that.
Thank you, doctor. My husband has been recently diagnosed with Parkinson's. Do more physical changes also occur at the same time as mental changes?
30% of the patients with Parkinson's disease may develop psychiatric or cognitive changes. Cognitive changes are the changes which affect memory and sometimes the behavior and the mood. So these are the changes that you may see in 30% of the patients. Most of the patients respond very well. The same levodopa that we give for Parkinson's disease also improves the functioning of that. However, as the disease advances, 6-7 years down the line, or 10 years or 12 years down the line, each patient is an individual patient, I told you earlier. So as the disease advances, then the psychiatric or the cognitive changes may sometimes overpower the motor changes or the motor weakness. So it is important for us to find out what point of time this patient is and whether he has another disease similar to Parkinson's disease. Many times the diagnosis of Parkinson's disease is made very loosely because physicians do not have adequate time, or they do not have the concentration to give, and they would say this is Parkinson's disease. And it is easy to do that because the treatment for all Parkinson and Parkinson related diseases is the same. So if I have to give you same treatment, whether you have typhoid, malaria, or viral fever, then I'm not going to be so much fixated on trying to differentiate 1 or 2. But yes, if the treatment for viral fever and typhoid is different, then I will definitely differentiate between these 2. Same thing happens for Parkinson and non-Parkinsonian symptoms. And one of the ways to find out whether you may have something what we call commonly as Parkinson plus or non-Parkinson symptoms is when you start finding that you are not responding to the Parkinson's treatment. And now it is common sense. If you are not responding to the treatment for the disease that you are being diagnosed, obviously there is a difficulty in the labeling of the disease. Otherwise, you have to respond.
Are there any common factors that can affect someone's thinking, and what changes needs to be made at home having someone with Parkinson's disease?
Some of the people find walking and gait disturbances a major handicap, and as the disease advances, I have seen patients having support, especially in their washrooms, for using it for bathing or for toilet. They make additional attachments and brackets, or there are special kinds of commodes available for Parkinsonian patients. Yet I have to see that in India. Maybe they may be available in India, but I have seen them abroad. So those are the things that happens, mainly the washroom area. Then the second is moving around the house. These patients are, some of the patients who have more tendency to fall may have some kind of wall supports that can be installed at various places. And then there are aids for Parkinson's disease patient, like laser cane stick or a walker that they can use to improve their mobility within the house.
Thank you, doctor. My dad is 79 and has had Parkinson's for almost 20 years now. Initially, he was able to function well with medication. However, these last years, his conditions has grown so worse that despite his medication, he is unable to be stable. Is deep brain stimulation a worthwhile procedure for him?
We do not go by the physical age of the patient. We go by actually the mental behavior and the physical constitution of the patient. A 79 may be a very fit 79 may pass like 70, or a very weak 65 can look like 75. So we need to evaluate this patient. Obviously, surgery beyond 70 years has to be done with a care and lot of thought and with very high level of precision to avoid any side effects of surgery. Because what we have to do or ensure, and we tell the patient, I tell my patients, is that one thing that I try to do or try to make sure that I do during the surgery about patients above 70s, that no way we can do them or make them worse than they are. No patient should be made worse than they are, and they never would be. But above 70, the responsibility totally changes. So we try to do surgery with a great amount of care and understanding, and we now have also perfected the surgical treatment for, which is different from what we offer below 70, and also the targets in the brain we have changed to make sure that this patient, so if this patient's father is mentally sound and physically strong enough to be considered for surgery, then obviously he can consult us and find out whether we would like to offer them. Once we decide, then it would be up to them to accept it or not. But first of all, we need to also be convinced whether we would like to offer them surgery or not.
We have a question. Recently, my mom, who has Parkinson's disorder, has been experiencing muscle aches right after consuming vegetable protein. The aches are usually in her legs. Is there an explanation for this? What should she go about doing to address this issue?
As I told you earlier, the protein intake will interfere with the absorption of levodopa. Muscle aches are usually seen in patients of Parkinson's disease during off condition. This patient's mother must be suffering off condition. Off condition is a period wherein it's like a toy, wherein you put a battery and the toy starts working, you remove the battery, toy is flat. So off condition happens in patients of Parkinson's disease like that, on, off. And you can see from the face of the patient, the moment the patient gets effect of medicine, he'll start smiling. And you see a patient in off condition, hardly expressions would come to his face. Now this patient, most of the time when they are taking medicines not correctly or combining with other things, the effect of medicine may not translate, or they are advanced Parkinson's disease, even the correct way of taking medicine may not bring in on effect, and that is when they would start complaining of pain. Deep brain stimulation is one of the surest way to relieve and permanently relieve this aches and pain.
Thank you, doctor. How soon should one start medication for Parkinson's disease?
Again, when the disability comes to interfere the activities of daily living, comes to interfere with their job, that is when they have to think and consider medical treatment. Do not delay medical treatment, because this is one important message that I want to convey today. Because there is a concept amongst large amount of doctors to avoid starting the medical treatment for Parkinson's disease. नहीं आपको अभी जरूरत नहीं है. You can wait. अरे who is the doctor to decide I can wait or not? As I told you earlier, my patient wanted to play golf. Who am I to decide whether I should allow him to play golf because he has got Parkinson's disease? If my treatment can help him play golf, I have to give him opportunity to play golf. Yes, my job is to explain him the pros and cons of treatment. I have to tell him what would happen if he starts treatment, what if he doesn't start treatment. But then the decision has to be the patient's, not the doctor's. So do not go by your doctor to tell and say, no, you don't require treatment. Oh yes, I require treatment. That's why you have gone to the doctor. The doctor is not a celebrity that you go to take his autograph.
I have another medical condition as well as Parkinson's. What should I do?
You got to get both treated.
Thank you, doctor. Sir, my father is 78 years old. He's a patient of Parkinson's for the last 10 years and having a problem of high TSH. The medicines he takes are Syndopa 3 times a day, Eltroxin once a day. He does not smoke. For the last 1 year, he has been suffering from extreme weakness. What should we do?
I think your father would need a better medical management, Once again, he has to be monitored carefully for his thyroid functions and also concurrently for the medical treatment of Parkinson's disease.
How will Parkinson's disease affect my work?
As I told you, that Parkinson's disease is characterized by tremors, slowness, and bradykinesia, and more or less, the way the society has been put in, it starts eroding your self-esteem. And today, on this platform of World Parkinson's Day, I want to give one message, which is a strong message, is that do not change or modify your lifestyle because of Parkinson's disease.
We have a question. Sir, can stem cells be offered for Parkinson's disease treatment in the place of surgery? Kindly advise.
No, no, no. No stem cells. Nowhere in the world stem cells are even being investigated. I'm not being saying therapy, being investigated on patients for Parkinson's disease. So even once we start investigating him, then we can decide whether we want to offer them for therapeutic option or not. And I'm on the board of all the international major societies working in this field. And I know the latest science, the cutting edge science, even before anyone else would come to know, because I'm a part of those scientific community which shares this. So there is no stem cell treatment being explored in Parkinson's disease. So do not fall for this con.
Thank you, doctor. You were talking about dementia when we were talking initially about this. Is there a link between late-stage Parkinson's and dementia, doctor?
Yes, I told that 30% of the patient may end up getting some form of memory loss.
My uncle has Parkinson's for the last 18 years. Suddenly he is acting confused and does not respond to us at times. What would you suggest?
This is the side effect of medicine. Second, he may be having concurrent infection. So you examine him for urinary tract infection and chest infection or dental infection. And otherwise, his medical treatment has to be better managed.
I am a 40-year-old female trying for a baby. I have tremors in my hands, and some doctors have told me that these are intentional tremors and nothing to worry about. None of the doctors were neurologists. Is this Parkinson's? Should I see a neuro ASAP? What happens if I get pregnant? Can I take medications for Parkinson's if it turns out to be?
You can continue taking medications even during pregnancy for Parkinson's disease. That is first answer. Second, yes, you should consult a neurologist to find out whether they are intentional tremor or Parkinsonian tremor.
Thank you, doctor. I have tremors for the last 9 years, but till now I did not consult any doctor for my hand and leg will be shaking. Please give some suggestions to recover, because I have been planning to get married in the next 2 years.
We will have to review you, because without examining the patient, I cannot give any diagnosis.
My friend is suffering from essential tumors of the hand while writing holding a glass. Now he has started to have a shake in his voice. Is it Parkinson's?
No, this is, as you initially said, it is essential tremors. Why we call it essential, I don't know. But in the previous question was about intentional tremors. So these are intentional, essential are all same words. And they usually are hereditary. If this tremor is becoming a handicap, he can seek surgical options.
Hello, doctor. Can you suggest a homeopathic treatment for head tremors? I also have depression, tingling, and a needle prick like headache. Sometimes a splitting headache too.
Unfortunately, I do not recommend or endorse any homeopathic treatment, because first of all, I'm not qualified for that. And second, I have some level of reservations about that. So I think you would be asking a wrong person on this.
We have a question. What are the side effects of DBS?
That's an interesting question. If you Google, there would be more than 100 side effects. But if I have to tell it on this platform in a one sentence, that I have not had, in more than 450 patients that we have operated, a single patient whom we had to stop deep brain stimulation for side effects. There would be some side effects, but we can always counter them by either medical treatment or by reprogramming the DBS.
Thank you, Doctor. Apollo Hospitals has launched the Advanced Center for Movement Disorders today in Chennai. Would you like to elaborate on that?
Yes, as I was telling you earlier, Parkinson's disease has not remained a single focal disease of a degeneration in the brain. It is now considered to be a spectrum of disease with predominant Parkinsonian symptoms. Now, this symptom can be only addressed by experts in their subspecialty. So if the patient has autonomic disturbances, I would need the help of a good cardiologist who understands Parkinson's disease and cardiology. If the patient has hesitancy in urine, frequency of urine, cannot hold the urine for long, then we need to find out that this gentleman is having prostate or urological problem because of Parkinson's disease. And this differentiation is very important. A patient of Parkinson's disease would come with a back pain, and a few minutes back I told you that the pain could be because of lack of medicines. And he may end up with a spine surgeon, and the spine will be degenerated. Every 60-year-old person, even my spine is degenerated. So every spine you will find a reason to operate. And if he gets operated, he will not get benefit. So this Advanced Center for Movement Disorder has been designed or conceptualized for that particular purpose, that we provide a 360-day care to this kind of patients, so that every patient get more individualized tailored treatment, whether it's from psychiatrist, psychologist, urologist, cardiologist, or a spine surgeon, or neurologist, or a neurosurgeon. And we can give them a tailored solution rather than just one pill.
Thank you very much, Doctor, for a wonderful and informative session today. For appointments with Dr. Paresh Doshi, Group Advisor, Functional Neurosurgery, Apollo Hospitals, may be contacted at 9930-960-960. I repeat, 9930-960-960. Thank you very much, Doctor, and thank you, viewers.
Thank you, everybody.